People living with cerebral palsy complain that the political and social environment in Lesotho does not cater for people living with the condition. 30-year-old Residisitswe Rantini, who is currently a third-year student at the Institute of Extramural Studies, expressed that due to his disability, he was delayed commencing with school from an early age, saying each time he applied for schools, he encountered stigma because of his condition.
What? Are you kidding me right now? Like, are you crazy? You must remember that I met this person on so many occasions during the application process, and we actually saw each other, greeted each other, spoke for a few hours, and yet he tells me he didn't see me. The gist of what their complaint was is that the mass communication department, it's on the 3rd floor. You got us. And there's steps. Like a lot.
Antony noted that many other challenges he encounters on a day-to-day basis was the challenge of accessing services such as using the ATM machine. He said even though the banks encourage inclusive participation in the economic growth, some of the services do not cater for people living with such conditions.
We should participate in economic activity. But really give that time. ATM, the first rule they give you, don't give your ATM card to the third party. But yet now, you know, like the man.
Similarly, Moko Tatu, a mother to a child living with cerebral palsy, said the health service providers are not urgent enough when it comes to cases of cerebral palsy. She said apart from the fact that Lesotho only has one physiotherapist, patients are not attended with urgency, as she had to call a doctor herself after giving birth and realizing that her son's skin was turning yellow.
Yes. What do you mean how not doing a It's only then that the doctor advised me the only thing that can assist my child to physiotherapy and occupational therapy. It's only then it's only then that he took the bugana again. Of which cerebral palsy
Tatu stressed that the political and social environment in Lesotho is not friendly to people living with cerebral palsy.
And then I realized Wanaka is severely affected. I have to prepare for my which means it's no more my dream. So, inaccessible homes that do not allow easy movement for those who already are on assistive chairs. Schools are not accessible. Public places are not accessible. Some are not able. They can't even get there because
according to Mogata Cerebral Palsy Association of Lesotho's database, 134 children were recorded in the 10 districts of Lesotho. The database also indicates that the highest district with children living with cerebral palsy is Leribe with the prevalence of 45, followed by Maseru with 34.